by Chasing the Rainbows with your host, Bernice Quisenberry.
Today's segment of Ask a Maternal Fetal Medicine Doctor is with Dr. Serena Wu, MD, and fellow of the American Congress of Obstetricians and Gynecologists, is a maternal fetal medicine doctor specialist who has experienced her own baby loss. We appreciate her being here and willing to give her time to all of us fellow survivors. So thank you so much for doing this, Serena.
Thank you, Bernice, for having me and inviting me to be on this segment. I'm very excited and feel very blessed to be here with you. Little bit about myself.
Yes, please share with the listeners.
I've been a maternal fetal medicine specialist for the last just over 15 years. I've landed here in Lancaster, Central PA, Lancaster County, for the last coming up on 8 years. But before that, I've practiced in many different places around the United States. And I think that's important in the sense of me being a doctor, is that it gives me a lot of different perspectives on the different populations of people of who we serve.
Absolutely. Yes. Oh, and I appreciate you sharing that. What are some of the areas of interest that you have with your specialties and things like that?
So part of being a maternal fetal medicine physician is that we take care of both the mom and the baby, specifically through pregnancy and even delivery and after. What makes a pregnancy high risk is anything that is high risk to the mom, baby, or pregnancy. So whether that's a mom that has a lot of medical issues, such as high blood pressure or diabetes, or even just age, we take care of moms with those kind of issues. The baby could be high risk, meaning a baby with a genetic condition, or born with say a limb difference or something that just didn't form correctly.
Absolutely.
To a pregnancy that has a short cervix, low fluid, constant vaginal bleeding.
Yes.
So those would be considered high risk, and those would be patients that would be referred to a maternal fetal medicine specialist.
I appreciate you going through that and explaining, especially for people like me, to hear that and what areas you've seen and things that you've seen and done with your patients. So what's amazing is that Serena joined our board of directors at Chasing the Rainbows, which we're so blessed to have her alongside our organization, as you can tell, and being a medical professional, in the OBGYN world and labor and delivery, maternal fetal medicine, all of that. Something that I feel, that we have some commonality with is, previous career of mine was in insurance, and you're seeing people's worst case scenarios playing out every day, with claims like fires, car accidents. It is their worst day of their life when these things are happening and the catastrophes are. And I know that you can relate, where you're seeing those less than 1% cases playing out and all that anxiety, and it just creates a whole new dynamic, especially when you were the mother on the other end. And I think, you doing this for our listeners and you being present and helping other of our fellow survivors with getting these answers is huge for me, for others, with the processing and the healing. I do, before we get into our story, where I'm going to give a 5-minute synopsis on what happened in my eyes, and then Serena will kind of dive into a quick medical synopsis of, and then I have a bunch of questions that I need answers to. There's things around the loss that just don't sit right with me, and I'm the type of griever, I don't know if you can relate or not, Serena, that I need these answers. Like, I can't just sit there and wallow in the what if or woulda, coulda, shouldas if we can get answers.
Right. And moms and birthing people need to know that these answers are valid. Or, these questions are valid. And that there are no wrong questions and no wrong answers either.
Right. And I think hearing it from, you and other doctors and things like that. It just makes you feel more, I hate to use this term, but like right with your thoughts and feelings. Like these are valid. These are okay to have, and I can go and talk about them in a safe space with my provider. So this leads into our disclaimer. We are not giving out medical advice, treating any person, diagnosing any person all throughout our podcast. This segment is to give that piece for our listeners who are struggling with some questions, but we are opening the ability to have that dialogue without feeling judged or silenced around our losses. We are promoting awareness and actual feelings that occur during our losses for a safe space to go and turn to talk about those thoughts openly and honest. So for medical advice, treatment, or diagnoses, please consult your primary physician or obstetrician. This is just a safe space for us survivors. Did I cover it all?
I think so, yeah. And it's very important to have a safe space. It's very important to feel that you can be open and be able to ask the questions and have a dialogue around a very emotional and can be very emotionally charged topic as well.
Absolutely. And I think sometimes, too, these topics are a little controversial because, as a patient, I just want these answers, not for any other reason than just to hear them, to get validated, like feel like I'm being heard. And I think sometimes like there's a disconnect like between that because it's hard for us survivors to go back to our OBGYNs after our losses because, it kind of reminds you of that place of where you go back.
Right, exactly. And then there is some post-traumatic stress.
Absolutely.
Going back into walking through the hallways, walking back into the office, going into that ultrasound room. I mean, it brings back a flood of memories that I think a lot of people don't expect.
Right.
And it opens up feelings that one probably has put away.
Right.
To move on.
So with you and I opening this dialogue with the events that happened around our loss, our daughter's name was Brooke. I'm going to dive in to just give a quick story around what happened, the events, and then from there, we can get into our questions if that sounds good to you, Serena. So the events that occurred were my husband and I were later in life when we met. And so I was advanced maternal age when we decided that we wanted to have a baby together. And I was 35 years old. We were dealing with some secondary infertility. We had acute PCOS, uterine fibroids. I had multiple surgeries. So it just caused a lot of scar tissues. So we were having some issues getting pregnant during that time. And then when we were finally pregnant, it felt like a dream and it was surreal. And during the pregnancy, the early days, felt like a dream. And then around 10 weeks, we all of a sudden had some profuse bleeding. And I ran into the hospital at the time to get checked. And at that time, they said, okay, could it either be that you miscarried a twin or that the placenta was implanting, and that's what caused all of it. And everything looks great. Brooke's healthy, fine, kind of ordeal. Go home, everything was fine. And then around 27 weeks is when I noticed some old blood coming out, and it wasn't a lot. It was like quarter size. With only a couple times throughout the day, nothing alarming, and that can be normal. So I go into my doctor's appointment 2 days after that occurred, and they sent me over for an ultrasound. Everything looked great. Fluid was there, no issues, no alarms, and we were supposed to have ultrasound 5 days later with maternal fetal medicine specialists. Well, we were supposed to cancel that because we already got our ultrasound. But for us, we wanted to selfishly get more pictures because you don't get that during an emergency ultrasound. So we go in for that appointment 5 days later. And at this point, I knew something was wrong. Like I could sense it. It wasn't like I noticed fluid. I didn't notice anything else coming out. And honestly, the blood stopped. Everything was fine. Everything resumed back. But I just had that gut-wrenching feeling. We walk into that appointment, and the second the doctor walked in with the results, he said, you need to be on bed rest in the hospital immediately. So after that, I didn't hear anything. I did hear that we didn't have fluid anywhere. I was trying to answer questions, but honestly, it felt like I was in an outer body experience looking down on myself. And then they were walking me, through the hospital to get me into a bed and get me checked and start, with antibiotics and different things and doing all these tests because we didn't know what was happening. So after 2 days of being in the hospital and getting tested and her heart rate keep tanking at night and me drinking apple juice and orange juice. And despite all of that, the second, we turned 28 weeks, that day we delivered her. And when that happened, she was born completely healthy. She just needed to grow more. She only had a CPAP put on her. She didn't need to be intubated or anything like that. And that's what she did for the next 5.5 weeks until March 16th, when we got the call from the doctor, the neonatologist that morning in the hospital, saying that she threw up breast milk and her belly was starting to get hard. However, we still were not alarmed or concerned at this point with our medical team, just because they thought it was from the CPAP, from the oxygen getting pushed into her abdomen, because she was presenting as a healthy, strong baby the rest of the time in the NICU. So by the time we got in there, just the events around all of it, being in there for those 6 to 8 hours before she passed in my arms, it was just a whirlwind of events. And she started crashing, and for 45 minutes they tried to bring her back, and she ended up dying in my arms. So when that happened, we had a lot of questions that we needed answered. I'm the type of person and griever that needs to, it's better for me to know than to not know.
Right.
If that makes sense, Serena.
Yeah. If you don't mind, I had just some questions to clarify for our listeners.
Absolutely. I appreciate that.
After your first ultrasound, when you had your first bleed, up until 27 weeks when you had your second bleed,
Right.
Did you have any other ultrasounds in the meantime?
Yes, I had the anatomical scan and just various check-in ultrasounds just to make sure everything was good.
Right. And you had your anatomical scan with a maternal fetal medicine specialist.
Correct. Yeah,
Okay.
we engaged completely with a team.
Okay. And that being said, I think the anatomical scan is an ultrasound done at 18 to 22 weeks. We look at baby from head to toe, and I think because you were advanced maternal age,
Right. I know, geriatric pregnancy over here. I know
that you had that ultrasound with maternal fetal medicine.
Right.
But other than that, your pregnancy was completely normal. Nothing with the placenta that they saw.
Nope, nothing that they saw. Everything was looking great. Our pregnant, outside of just having that little bit of bleeding at the 10 weeks and then just a little bit presenting on 27. But outside of that, pregnancy was great. Everything looked great.
Okay. Right.
Yeah.
So your pregnancy was otherwise going along normally, except for those 2 bleeds.
Absolutely. And I also had a previous pregnancy with our son, who was 8 years old at that time, or 9 years old. And so when so I've already had a normal pregnancy, didn't have any issues getting pregnant, all of those things. And then to go to this extreme was a lot different. Yeah.
And then what you said, I heard that you heard no fluid around the baby.
Right.
Can you tell me a little bit more about that? Can you remember or recall? I know it was a whirlwind.
Yes, it was. But yes. So I didn't notice at all that fluid was leaking out or anything. So when I was told that there was, in the quotes, like the no fluid, I honestly didn't even know what that meant, because I said, well, I didn't feel a gush of fluid, or I didn't notice any leaking. And who knows, when you laugh and stuff pregnant, like what, but outside of that, like what else, so when they told me that, I was shocked. And then they, we needed to check different things, the kidney levels and all of that, to make sure that Brooke was producing fluid, and they had to do all those things.
Right.
Because they were worried. Yeah.
So one of the things about low fluid around a baby, which is in the uterus, we worry about if you've ruptured your membranes. Ruptured membranes is what we term when the baby who's in a sac. And if you think of the sack as being double lined, so if you double bag your groceries, that's kind of my analogy of the groceries or whatever's in there is being double bagged. So the membranes around the baby is double membranes, and the baby's within that sack.
Wow.
Rupturing the sack means there's now a little hole somewhere in that bubble, and that's fluid coming out. But my understanding is that that's not the case here.
Right. Yeah. And not that we were,
aware of.
Aware of.
Yeah.
Absolutely. So it was a shock. It was that abrupt, unexpected news we
Yeah.
were not expecting at all in that appointment to being put on bed rest.
Right. And low fluid around the baby, the other things that we think about is
Oh,
that
this is great. Yeah.
it was the 2 episodes of bleeding. I mean, it could have led to some chronic bleeding that, and not all bleeding that happens in pregnancy can we see all of it.
Right.
You can have a little bit of bleeding in pregnancy, but it's hidden because it's behind the placenta. So we don't see all bleeding, and that may have been the case.
Right.
With the first episode of bleeding, where that started that cycle of where the placenta was just slightly detached from the uterus, but not so much so that it was causing harm to the baby, because the baby was normally grown via the ultrasounds. We know that
Right.
via the ultrasounds.
Yeah.
And then the fluid was all normal until all of a sudden that second bleed.
Yeah. And see, it was so just shocking to us.
Right.
And you explaining it just makes sense. And I can actually like put it into, into my mind, and it's like, okay, I can process that.
Right.
Yeah.
And so the reason for hospitalizing you
Right.
was that low fluid around the baby. We need to know why. The number one reason for most low fluid around the baby is that somehow, you've ruptured your membrane somewhere.
Right. Right.
And so I know we would have evaluated you for that.
Right.
The second reason for putting you in the hospital is that if you've done that, the likelihood of most women going into labor is pretty high.
Yeah.
So when you're not at the time where you should be, like 37 weeks and beyond, we want to prolong your pregnancy.
Right.
And
Makes
to
sense.
do that, we know that giving you some antibiotics for a week can prolong the pregnancy time frame.
Right.
We also want to give your baby steroids to accelerate that lung development.
That's right.
Because they're not going to be ready if by any chance you would have to deliver prematurely.
And that's what they did, because that's why she got the CPAP then instead of and they feel like that was a part of it because she had 2 days of those steroids.
Yeah.
So.
And then the other thing that we worry about with low fluid is that fluid around the baby does cushion that umbilical cord.
Oh, right.
So not only are we watching to see if you go into labor, but we are also watching to see if the umbilical cord gets compressed. Because if it's in a position that the heart rate keeps dropping, like you mentioned, the umbilical cord is getting compressed is one reason. Could
Right.
be one reason. And if that's the case, we may have to recommend delivery sooner.
Right. I just appreciate getting your point of view on this so much, and getting better educated on some of these things. And this kind of leads into the next couple questions that I have. It's around our delivery, it's all OBGYN questions for Serena, but these were all valid after we went through our losses.
Absolutely. And to be able, I know then that that after a loss, you start going back and second guessing a lot of your what you did, what you were doing that day, what you were eating, what you were drinking. Could it if you stayed at home and
environmental,
could that have made a difference? Absolutely.
Oh, I know. And then just question your every move up until that moment of when we were going through what we were. And it is. And so, my first question was, and this is to Serena, did drinking a Diet Mountain Dew or a fountain soda during pregnancy erode my placenta? And I drank about 1 or 2 a week.
Absolutely not.
Okay.
Yeah.
So the carbonation, CO2, nothing. Okay.
No.
That wouldn't have done it. Okay. And honestly, it made me worried too because of the fake sugar and that kind of stuff in diet soda. Okay. Did my uterine fibroids or ovarian cysts play a role in early delivery or issues?
Probably not necessarily the ovarian cysts, and it's hard to say. Uterine fibroids can cause issues in pregnancy, can cause issues with infertility. They can, some of the issues that we do see with fibroids is it does divert blood away from, can divert blood because it feeds itself as they grow during pregnancy. So, but those are fibroids that are significant in size. So I'm talking about 5 6, 7, 8, 10 centimeter size fibroids, like another baby, so to speak.
Oh, wow.
And that, so not just one that's a couple centimeters.
Right.
Also, if you have multiple fibroids, that can also affect how the pregnancy goes. And so things that we would watch for is how well the baby's growing.
Right.
And if you, another thing that can happen is those fibroids, they run out of its blood supply.
Right.
And they start what we call degenerating. And degenerating just means it starts getting smaller, and they'll go, they may or may not go away, but they start getting smaller.
Oh.
That can cause like preterm labor symptoms and true severe abdominal pain.
Now, but you would see those fibroids and the cysts in the ultrasounds, and the doctors would be full aware of them and watching them the whole time during pregnancy. So
Right.
there was nothing that was alarming in my ultrasounds, nothing that they
Right.
brought. So
That's
right.
correct.
Oh, right. And I guess, wow. Yeah, that kind of answers my, yeah. Oh, thank you. Oh, thanks, Maria.
But it shouldn't cause bleeding.
Right.
So, I
Right.
think for...
Oh, yeah, because that's what I assumed, like, at first when the blood started coming out, I assumed it was from a fibroid or cyst because that's what I've seen in past, outside of pregnancy.
Right. So the fibroids would cause issues with pregnancy, more related to growth of baby, more related to maybe abdominal pain and preterm labor,
yeah.
but not necessarily causing you bleeding.
Right.
Unless you were in labor.
Okay. Wow. Yeah. So, okay. Next question. Did going to a bonfire for 30 minutes. Now, I was about 10 to 20 feet away from the fire. I was not breathing the smoke in. I wasn't like direct in it or anything, but it is a fire with wood and heat source. Was breathing anything in from trees that were burning or limbs that were burning, any fungus from a tree? Would that have caused anything?
I couldn't speak about the fungus.
Right. I mean, and was there really even fungus on it? I mean, I don't know. But
Inhaling smoke, not with the time frame and being the distance.
Yeah.
That shouldn't.
Okay. Okay, so we moved 2 weeks prior to this abrupt delivery. We thought we were going to have, 3 months left to get this house ready and stuff. But did me switching environmental changes or being in a new house to new allergens, new everything, could that have caused these issues?
Not necessarily. No, it shouldn't.
Okay.
Unless you knew of a specific teratogen.
Right.
It's a specific exposure, which none of the more common exposures
Right.
I would be thinking about, like lead.
Right.
Should cause all of a sudden acute change in your placenta.
Yeah.
Or with baby to cause low fluid.
Right. I even went down thinking, like, was there something wrong with our drinking water? Or was something wrong where I was, because I was inhaling so much water during the day, drinking those,
Right.
The amount of water you needed to. Okay. Yeah, it's true, though. There's environmental questions because it is a change.
Right.
So I appreciate that, Serena. So when we moved in then, I shampooed with a hand shampooer. One of the ones, it's very lightweight, but it looks like a vacuum cleaner. And I shampooed about 4 of our carpets. Would that have caused any of my problems, you think?
It shouldn't.
Okay.
No, I mean, if that was your job and you were doing that daily,
I know, right?
maybe lower fluid. I mean, there is a connection between stress and poor obstetrical outcomes. It's well known that people with birthing support, birthing mothers, birthing people with high stress jobs tend to have lower fluid, tend to deliver earlier, but if it's just one time, then should not.
Now, are you talking about like physical, or is that,
right?
You're not talking about like emotional stress, because like I was told, with our other pregnancy then, I was so stressed that whole time and I worried. I was like, and it was all emotional, mental stress.
Yeah.
You're speaking physical with that?
Well, we are learning more and more about pregnancy.
Right, of course.
And there is more of connections with depression, maternal mental health, that I can't say for sure that high levels of stress does not affect the baby, does not affect the pregnancy. But to say definitively in your case,
no, right.
Was that the reason why the abrupt change? Usually it's not.
Okay.
Usually, it would be something more chronic.
Yeah. And something over like a period of time, like that, it would,
Correct.
like you said, like that repetitive motion. Okay.
Right.
All right. Oh, good. Thanks, Serena. Could it have been from taking too many baths? Now, let me also say this. I was very cautious of how hot the temperature of the bath was, but I did enjoy, especially for swollen body parts. You know what I'm talking about. Like getting into a bathtub just hits the spot.
As long as your bath is not whirlpool
Temperature.
yeah.
Okay, good. Like we're talking like 100 or over.
Yeah,
Like, yeah, okay. Like 98 over. Okay.
But no, that shouldn't be the case.
Okay. All right. Because I do enjoy my baths. Okay. So also it scared me to eat lunch meat just with that. But I ate a lot of lunch meat and salads because that's what I craved. But I was worried about listeria, all the different, bacterias. I did I always cooked, I shouldn't say tried, I did cook my lunch meat for at least 30 seconds in the microwave, which is not a good idea ever. And that's how I eat my hoagies. But did doing that or eating lunch meat, eating salads, anything like that, could that have caused my issues? No.
No.
So that it wouldn't have been from like listeria or anything like that. Does that make sense?
Yes.
I'm asking that. Okay.
Should not.
Okay. All right. And also, so before I got pregnant and during pregnancy, I was a runner. So I really cut back though. I only did 2 to 3 times a week for about 2 miles each time. However, then I didn't do it in my last pregnancy because it scared me too much. But running is almost like my form of meditation. Would running have caused my placenta to
Again, running, and if you were a runner and this was something that you did and you continued through the pregnancy, shouldn't have caused this.
Right.
Again, if you, it wouldn't have been an acute change is what I'm
Right.
trying to say.
Yeah, no, I understand that. That makes sense. Absolutely. Okay, good. I am really glad that we got those questions. Now, these next set of questions I have are really around Brooke and her loss and the events around her loss. And Serena and I talked, these we did get answered by a neonatologist already previously, but I am going to ask Serena from her point of view as well, because, I can never get enough opinions about this or enough eyes on our daughter's case. So when our daughter died, it was found out afterwards through testing and things like that she died from neck, which is where, am I right, where the bowel dies off, right,
Correct.
Serena? And it's pretty quick and sudden. It happens in adults, babies, at any age. And so I had a lot of questions then because I thought, around the abdomen, that reminds me of digestion. So I was thinking then in my head, I had it that it was because of my breast milk. It's because that's the only thing that she was eating. That's her nutrients, and it's going into her, intestines. And so, I asked, was it something that I ate that went into my breast milk that could have caused this?
And I'd like to say that most likely not, but as I am not a neonatologist, I think that the best people to answer would be not your pediatrician as well as the neonatologist that were there taking care of Brooke.
Right.
That being said, these questions are very, very important, and
Right.
And no question is a dumb question.
And I appreciate that, Serena, because and when you're going through it, these all feel, and my practical brain just went out the window. It was like any kind of education I've ever had. And as you can tell through all of this, I still just can't, I can't think practically when it's my own kid, but then when it's someone else, you get it. It's just when it's your own self and you're so close to it. So this other question I had was about sucking helium out of a balloon. A few days prior with my son, we were doing funny voices and we did 1 or 2 intakes of helium. But then I thought, did helium go into my breast milk and then go into Brooke and cause this?
Yeah, most likely not.
No, most likely not. Yeah. And that's what we were told too. And was this because of an outside virus, germ, allergen, or any kind that I was exposed to that I brought into the NICU on me?
And again, that is very unlikely as well.
Right.
Yeah.
Was it something that was wrong with my milk? Like I left it out too long, or for example, they tell you, you can only leave your breast milk sit out for 3 hours. And if I left it out for 3.5 or 4 hours, would that have caused this?
Probably not.
Yeah. And then we added Prolacta to our breast milk, which is a human derivative added to help with weight gain and things like that. And I was wondering, well, could that have caused it? Because that was added to the breast milk, even though it is a human product.
And I'm not familiar with Prolacta.
Oh, right. Yeah. So but we did get that answered, and we were told that it wasn't. But Brooke's only precursor to neck was prematurity. And then the other reasons, like she's only ever had breast milk, and I'm forgetting the other ones right now, but even though that's the generic reason, is that still the case with neck, or has there been more development, do you know, with it?
That's still the three reasons.
Right.
Are the most what they would look for.
Right.
Predominantly.
Okay. All right. Thanks, Serena. And I think for me, like, we just want more answers than just like it all being bundled into prematurity. Like, if we could break that down a little bit more, boil it down where we could see, okay, well, it could have been this, or, it's just for me and that obsession with it. It's good for me to have the answers, like I said, to be able to process it. Is there anything that we could have done to prevent this?
That you as parents could have
Yes.
done? I don't think there could have been.
Right.
I mean, so unfortunately, it lands down to, and it's hard because that's not the answer that you're thinking or wanting,
Right.
that she was just born a little too early and
Oh, I know.
and only made it to 5.5 weeks, and then this is the reason.
Right.
And it's very unsatisfying.
It really is, because that acceptance, it's always like that room for error, or, something that went wrong, or, and you just, the woulda, coulda, shouldas.
Right. And the fact is that you and your husband were doing everything as parents, doing the best for your little Brooke.
Oh, thanks, Serena. Yeah, I mean, because you do. I mean, it's hard as parents not to beat yourselves up or think, like, could we have done more, or advocated more, or said something more, and you just go through all those questions. Did I, or we already went through that one. Okay. Now this is one, that's something that we have to live with. We don't know, because those woulda, coulda, shouldas, but if sending her by helicopter sooner, would or could we have saved her life?
And that's sort of looking into the crystal ball.
Right.
We don't know. We know the time frame now, but kind of like Monday morning quarterbacking.
Exactly.
Okay, we knew she had, 6 to 8 hours after that? Maybe, but then maybe that wouldn't have been the course if she was in the helicopter.
Right.
And maybe at that point there wasn't anything to send her by helicopter.
Right.
So not knowing and not being the doctor there at her bedside,
Yeah.
I can't say for sure.
Absolutely.
And who knows what would have happened in the helicopter.
Right.
So,
and that's right. And like, that's where I go back to. And I think what gives me some peace with it, not that we're ever going to have 100% peace with it, but is knowing that she got to look at me the last time she took her breath, and like, she got to, be with her mom, so instead of dying in a helicopter with some strangers,
Right. Yeah, absolutely.
but with me, who's, was with her every day for 10 hours, 12 hours. But I think, like I said, that gives me some peace, just knowing that I was the last person that she saw, and that, but Serena, I can't tell you how amazing this has been for me. I mean, even just to hear more about the medical diagnoses, because that's something that I feel like we don't get enough time with our physicians to be able to really talk through all of that during our office visits, because life is just busy for all of us, and we're in and out of doctor's appointments. So I appreciate you being here and doing all of this.
Well, thank you for having me. Yes. And I'm glad we got a chance to talk and talk through some of the things that we are thinking as providers, and giving the whys and the hows and the what fors to why we make those decisions or recommendations, that we do have you and Brooke in our hearts, and we do have the two of you best interests.
Yes. 100%. I feel that.
So, I mean, and I know I speak for myself, but I know none of my colleagues would ever want to recommend delivery at 28 weeks for anybody.
Oh, of course not.
Unless absolutely necessary.
Yeah, and I can see why now living it, Yeah.
Right.
But you just living it every day, you being there and you being there for the birthing person and being beside them and just like, being that compassionate provider just means more than you know. And an extension of that is you being here and doing this for the listeners. It just shows how it's nice to have somebody from the inside putting a voice behind this and cracking that silence for us listeners or survivors to get some answers.
Absolutely.
So thank you. So for our next maternal fetal medicine segment with Serena, please write in on our website at criedoutloudpodcast.com with your story and specific questions so we can hold your Q&A around your loss in a topic-specific episode in the future. Also, in our next segment of Bree and B, we need survivors to tell us what they either wish their support system did during their loss or things that their support system did do without even asking them during their loss that was extremely helpful. We are growing and trying to provide a better list of resources for families and would love this. And also, we are going to do a podcast episode in the future for this as well. So listeners, until next time, thank you so much for tuning in. And we are always with you, fertility, pregnancy, and baby loss survivors. Thank you so much, Serena, for being here.
Thank you for having me.
Thank you.